According to McCloskey, 2020, author Theo Gold stated that communication is your ticket to success if you pay attention and learn to do it effectively. This analysis discusses the communication methods that will improve the future success of Doctors Without Borders. More specifically, these solutions will help improve satisfaction among employees, reinstate the identity of Doctors Without Borders, and help with their future recruitments. Now let's move on to the first main point. There are three communication issues that need to be solved. The first is a lack of average supervisor communication style between supervisor and associate. Associates did not share their ideas or dissatisfactions with CEO King because they felt their opinions would not be heard. The solution to this issue is using the supervisor-subordinate communication by having CEO King implement an open-door policy for his employees. Caddy Gray, 2010, with the Society for Human Resource Management says an open-door policy should have a written procedure for how to handle various issues such as sexual harassment and coworkers fighting. Managers should also be trained on how the open-door policy works. Gray 2010 also says employees need to know who the trained managers are for when issues arise. Kramer and Basel, 2021, say that employees who have open communication with their supervisors are more productive and satisfied with a higher morale. This lowers the chances of employees leaving their organization. Now let's move on to the second main point. The second communication issue is lacking an effective management style, which is necessary to reinstate the identity of Doctors Without Borders. They are currently using an authority compliance management which focuses on getting work done, but shows low concern for employee relationships. This management style has led to low employee morale. The low morale took the focus away from Doctors Without Borders' identity, which is its mission. The management style that should be used instead is middle of the road management. This style has moderate concern for both production and employee relationships. Kramer and Basel, 2021, state that the developers of this style model suggest that managers who use middle of the road and team-oriented approaches will have the most productive groups. Now let's move on to the third main point. Emotion management needs to be implemented to help with future recruitments. Since there isn't any emotion management training yet, employees are expressing their feelings about work-related issues to other coworkers. If new or future recruits hear employees expressing negative emotions towards work, this could cause additional high turnover. CEO King needs to implement emotion management training for Doctors Without Borders employees. The training would involve a 6-step process. The American Management Association 2019 lists these 6 steps, which include identify and accept your emotion, identify your self-talk and your physical responses, affirm your rights, switch non-productive self-talk and physical responses to in-control responses, and communicate strategically. These steps will help employees to maintain their emotions at work. Now let's move on to the conclusion. The suggested solutions from this analysis are communication methods to improve the future success of Doctors Without Borders. More specifically, these solutions will help improve satisfaction among employees, reinstate the identity of Doctors Without Borders, and help with their future recruitments. When CEO King implements the suggested communication solutions, Doctors Without Borders can resume on focus delivering on emergency medical aid to victims of armed conflicts, epidemics, and natural and man-made disasters, and to others who lack health care because of social and geographic isolation. Champeau and Kyle, 2011. Thank you.